Greetings from Speed Institute. On behalf of all the faculty members, we bring all the greetings and best wishes to you for a wonderful and a fantastic achievement of rank number 1 in MCH plastic surgery in PGI Chandigarh session.
Thank you so much, sir. Thank you so much, sir.
And it's great and a privilege and a pleasure to interact with you today after securing such a wonderful rank, and hope it will bring a lot of happiness to you and your family as well.
Yes, sir. Thank you, sir.
So, can we know something about Dr. Shubham Sharma?
Sir, I belong to Chandigarh. I was born in Amritsar and have studied in Chandigarh from the beginning. I have done my MBBS and both my PG in general surgery in Government Medical College, Chandigarh itself.
Excellent, excellent. And we want to know why you want to do plastic surgery.
So during COVID times, actually I belong from a non-medical family. I had no exposure to the field. So when I joined general surgery, I had to explore the various options. So I worked with the consultant in plastic surgery for almost a year, and it was fascinating. I could work apart from my hours. It was interesting. So I thought that would be what I could do in future.
Okay, it's great. And your aim was to go for NEET or institute exams like AIMS and PGI and JIPMA?
Sir, actually, I am a fresher. I was, to be very frank, I was preparing for all India examination because my institute exam, university examinations finished just like 20 days before the PGI examination.
Okay.
But I have already completed the plastic surgery. I'd already completed the plastic surgery videos and the MCQs from the Speed coaching app. And I think that helped me a lot to crack this exam.
Yeah. We have been discussing about the preference for all India or institute exams.
I was preparing for all India examination, but I think I completed my plastic surgery videos from the Speed coaching app before December, before I started studying for my university final examinations. And after the examinations, I studied for like 20-25 days, revised my plastic surgery. And I think being a fresher helped me to score good in general surgery. So that, and a bit of luck, I think a lot of luck helped me to crack PGI.
Can you tell me something about your preparation strategy? And also, there is a lot of queries, how to use the speed learning app for plastic surgery? What to read for plastic surgery first and how to utilize, because the arrangement of content is quite vast in the app. So that if you could elaborate on that, so it will help the juniors who are aspiring for plastic surgery.
Actually, a lot of questions from plastic surgery are basically from the anatomy and the classifications. So initially, while I was working with as I already told, the consultant in my institute, I was working with him. So I started the book Grab and Smith, but that book is a little bit too extensive to complete in 1 year course. So this is where the speed coaching app helps. This combines and crisps the content and helps to give you the key points basically. I tried to go for the live lectures, but since I was a fresher and I had my duties, I could attend almost like 50% of those lectures. The rest I did complete I completed all the lectures from the app.
So how was your general surgery useful? Because the institute exams will predominantly ask only from a specialty book, correct? Yes. From Grab and Smith. So because even in general surgery also, Bailey does not give much about plastic surgery. It covers, but it is not very extensive in general surgery as compared to a plastic surgery. Because when you see gastroenterology, the coverage in gastro neuro in Bailey, it will be almost 50, I can say 30-40%, not even 50% compared to specialty. There will be an extensive coverage. I mean, in what way it should be concentrated for upcoming exams?
In PGI examination, 50% of the questions, the general surgery is almost same. So that is helpful. I think I was a little bit lucky because I was a fresher. So while preparing for my university examinations, I had read a majority of Sebastian and whole of the Bailey. So that helped me to crack the general surgery questions. And as of for plastic surgery is given very extensively in speed learning app. Even if you complete those lectures and do the MCQs, I think that will cover like almost 70-80% of the questions that are asked in the examinations.
What would be the role of general surgery in institute exams? And now, of course, in all India, it is almost 40 questions in general surgery for plastic.
Yes.
And also one more question which I want to ask you, did you complete the entire Grab and Smith? Were you able to do the entire book of Grab and Smith? How you utilized, how you could balance between the speed learning app videos and Grab and Smith? So these are the key things which everybody wants to know.
I started Grab and Smith book in almost like July, August, after which one of my seniors got admission in MCH Plastic and he advised me to go for speed learning app, which definitely helped me. I had completed like 20% of the book. Remaining, I did all the lectures from the speed app. Plus, there are a lot of questions and the photographs given Grab and Smith. I revised those just before the examinations. And
Okay.
being a fresher, general surgery has definitely helped me. And even for my university exams, I think the lectures from Speed app helped me a lot to clear certain issues and points, and that helped me in Vivas as well.
Okay. It's really great. Were you able to attend the general surgery live classes? Did you attend general
Sir,
surgery live classes?
I attended very later, sir.
Okay.
Even though the
Good.
timings were very appropriate, the app, the institute devises the timings so that a lot of people can attend. Like the general surgery lectures are in the night, and the specialty lectures were on Sundays. But still, being a fresher, it is a little difficult to attend those.
Okay, great, very good. Now, what will you advise your juniors who are aspiring for plastic surgery, and what you felt that during your preparation that if you would have done this would have been much better, something like that? If whatever you want to advise your juniors or friends or those who are aspiring for plastic surgery.
The basic advice would be to start early. The earlier you start, the better it is. None of my colleagues started preparing. I had a little edge over that. And plus, if you work in that field, the clinics would definitely help you, especially in plastics when you are aware of the anatomy. There are certain flaps, certain classifications, which you get to know better if you are attending the clinics properly. So I started around August, and obviously you build up gradually. You cannot like being a fresher or even those who pass outs you cannot expect to complete everything in a month or so. Plus, there are certain times when you think that you cannot do it. Especially for me, it was after the AIMS examination. The AIMS examination was held in between my university examinations. So after the AIMS examination, I did not have a good score. I was very depressed that I might not get a seat, and I started preparing for All India. That was the reason I worked hard for All India, but that helped me, and I could crack PGI.
Now, I mean, when you are working in a plastic surgery department, how many hours you are able to devote for this preparation?
So lecture, I did started I started doing the lectures for like around 2 to 3 hours daily, and after that, the MCQs. There are a lot of MCQs in the app. Like if you complete whole of the lectures and the MCQs, almost like 60-70% of the syllabus, especially of the specialty, is completed. But if a person gets time, definitely the standard book should be dealt with. Especially the photos for plastic surgery, a lot of photos are repeated in the papers.
Exactly. Tables were asked.
Yes, definitely so.
Okay.
Tables and photos.
Okay. So once again, I bring in all the wishes to you for doing a phenomenal achievement in PGI session 2021 for plastic, and it will be a great journey for you in days to come and years to come in PGI Chandigarh itself, and then
Thank you so much, sir.
a great plastic surgeon in years to come.
Thank you so much, sir.
Wholehearted wishes to you. Keep going.
Thank you, sir.
Thank you.